It's Shirley Gutkowski at Crosslink Radio, and I am here in my home office in Sun Prairie, and I wanted to just bring to light a couple of things that were happening on Facebook today that I thought would be a really good topic for the radio program, and that was how to avoid pain practicing clinical dental hygiene. And that topic seems to want to continue to come up over and over and over again, partially because of the way we practice and partially of the way we think we have to practice. Some of us work way too hard, partly because we just don't know any better, and partly because practicing ergonomically can be a little expensive. So I just wanted to elaborate on a couple of things that are important for everyone to understand. I've also been having ongoing conversations about this topic with my chiropractor, and so I thought this would be helpful for people that are not in dentistry per se, that maybe just want to help dental hygienists or just to avoid pain or something like that. This is what I considered to be at the time a posture that was, you can see here on my picture, that is square and that is appropriate. I'm not wearing a headlight, and I am wearing loupes. I've been wearing loupes for a number of years now, but we just we're never in a static position really, and we have to twist and address patients in a way that's unnatural. Their head is very small. The chair that the patient is laying in can be very wide. Those wide-headed chairs are a nightmare for dental hygienists, especially those that have a stomach like I do, where you have to really reach then. You have to double reach, I guess, in order to reach the patient's mouth and do the treatments. We also have an overhead light. If you're not wearing a light on your head, the overhead light is never in the right place. You're always putting your head into the light, and so you never really have a good picture. You never have a good example of what you can be seeing, because the light's just never right. So really you do need a headlight. I am not using a headlight right now. I have one. It's very old, and some of the fiber optics are kaput, so you can really tell how old it is, because I don't think they even use fiber optics anymore. So that is another thing. And then we also have our wrong hand. Our non-dominant hand has a lot of work to do and a lot of pressure. I invited my neuromuscular therapist to the office one Saturday with another hygienist, and we really went over the body mechanics of clinical dental hygiene, and we were all kind of surprised at how much pressure we have to apply to our non-dominant hand, and usually with our elbow up in the sky. So we're putting not just pressure on our hand, we're putting pressure across the entire arm, and that centers onto the shoulder and into the neck. I'm not going to go into all of the exact body part names because I haven't studied that in a long time. But you can just imagine how if you're using your left hand, for instance, and you are pushing against someone's cheek, and maybe their cheek doesn't want to be pushed out, how much pressure you're really applying onto that cheek, and can really see where those muscles can get tense and where they will eventually become shortened if you're not careful. Some of the older style headlights that are newer than mine and older than the new ones today have a clip. So the headlight is mounted onto your loupes, to your safety glasses, with the magnifying loupes on there, and then the wire that carries the illuminating tubes, or whatever they're called, along the arm of the glasses, and then that wire kind of goes down along your head, and then there's usually a clip right there to hold that up so that wire's not pulling against you constantly. It's really little things like that that really help make a difference in your ergonomics. But even so, we're always twisted somehow where our non-dominant side is elongated and our dominant side is foreshortened. So over time, if we're not really careful, we can get lopsided, and you just don't even notice it until someone tells you, you know, you're kind of crooked. Do you know that your left shoulder is up and your right shoulder is down, or something like that? I wrote an article a few years ago in RDH magazine making a case that flat feet can contribute to TMJ disorder. And really, you have to have everything lined up the way that it's intended to be, and you can't be twisted or short or long or anything like that. You have to be symmetrical in all measurements. When we're not working chair side, if we're going into a long-term care, for instance, long-term care situation, or working on people that aren't in a dental chair, our ergonomics are even worse. We have to bend over from the waist. We have our arms up in an unnatural position. We have a patient who may be resistant to some of our, not on purpose, but resistant to some of our manipulations. Our non-dominant hand will be holding not only the cheek back, but also the tongue. And if you use your tongue right now, you can see that you can really do a lot with your tongue. It's pretty strong. So that is the bane of the clinical dental hygienist. Obviously, if a dentist was doing this, it'd be the same kind of thing. Interesting, though, that a lot of the studies that look at pain and the reaction to pain and the level of pain between dentists and dental hygienists find that dental hygienists have more pain than dentists. I'm not sure where dental assistants fit in there, but it's somewhere in there. So that's generically speaking, we have to sit up and we have to be more ergonomic in everything that we do. And we have tools that can help us be more ergonomic. For instance, we talked about the Loupes, and I'll dive into that a little bit more as we go through our little half an hour here. But you also have to think about what you're sitting on, whether or not you're standing or sitting. I know a hygienist that I work with at one of the practices that I sub at stands on a super thick cushion, and she does stand-up dentistry or dental hygiene about half of the time. So she sits for part of the day and she stands for part of the day, and that's a really good way of approaching ergonomics and symmetry in your work. Something that almost never comes up, though, is sleep quality. A few weeks ago, we were talking with Jim Poole about sleeping and his system to almost sedate our patients into reparative sleep waves. And it just, every now and then I'll be asking somebody about it or talking to someone about it, and they're all in agreement that reparative sleep is almost impossible to attain these days for a gajillion different reasons. But that's part of this whole problem here. Sleep deprivation because you're working too hard, because you're playing too hard. I was talking to a bodybuilder a few months ago on this show who had a schedule that would kill the normal person. She was running from the minute she woke up to the minute she passed out, and that will be catching up with her. She looks fantastic. She looks fit. She is trim. But we don't know what's going on in the interior of her body. She works out for, I don't know, did she say 3 hours a day on top of it? And it's really crazy what we do with a mask of health that can be unhealthy as well. So this sleep deprivation piece here has to be addressed. You can't be pain-free if you are sleep deprived. Sleep deprivation increases heart rate variability, and that in turn increases your risk for heart disease, decreased reaction time and accuracy, tremors and aches. Symptoms similar to ADHD, impairs the immune system, increases your risk for diabetes, for type 2 diabetes. So, get yourself some sleep. Get yourself some real sleep. Now, one of the tools that we use in dental hygiene that we use a lot are hand instruments. And most of us don't really think that much about hand instruments. There was a big movement in the 1990s and early 2000s to increase the diameter of the handle. And so now we have these fat-handled instruments, or we have thin instruments. Where was I just the other day subbing, and there was a mixture of these super old-timey instruments with a real thin handle and some larger ones and stuff like that. So that's a really good strategy, is to mix up the handle sizes. The weight of the instrument is what we used to think is static. It is not. And the sharpness of the instrument is really, really important. We have really gotten so far away from sharp instruments that it's almost comical. We, as dental hygienists, are taught how to sharpen instruments for a very brief amount of time in our clinical dental hygiene school, and then we just don't sharpen very well anymore. As I went one day with my friend Patty DeGangi over to American Eagle, and it became very clear, and I suppose I got that message at Hugh Freedy when I did their tour as well. There are people that spend their entire career, their entire working life sharpening instruments. You can never, ever come up to that level of sharpness and that what do I want to say, the talent of those sharpeners. You just can't, because you're never going to be prepared to that level. So I would strongly encourage everyone to get sharpen-free instruments if possible, or send them out to be sharpened. All you're going to do is ruin them. Why not send them out to someone who is going to sharpen them to factory sharp specifications? And then you're going to say, but surely that's really expensive and time consuming. That's true. So why don't you just get some that never need sharpening, that are going to hold that sharpness for the life of the instrument? That's the key piece here, and that's what these American Eagle instruments do. I know this is going to sound like a commercial, but there's really only one instrument that has this level of sharpness for the entire duration of an instrument. So if your instruments usually last you about a year, and you're sharpening them pretty regularly, that's about how long one of these non-sharpening instruments are going to work for you. So here's the other thing, and I would like you to go to YouTube and type in American Eagle Instruments or XP Instruments. They have a bunch of videos there to really describe how this goes. But regularly, what we do when we find a piece of calculus is we put the instrument below, and if the instrument is sharp, we'll pop that off, not necessarily shaving it. We've always been taught, and that's still true, that we shouldn't shave off that calculus, because you're going to burnish it onto the root of the tooth, and that will set up an inflammatory location that we can't really see, and it'll contribute to the overall inflammatory load of the body. So here's what's happening, though, is that if you don't have sharp instruments, you're always burnishing the calculus, and you're always working too hard. You're never going to really get that off the way that you think you're going to, and sharpened instruments are very, very difficult. The other day I was looking at some hardness scales, and it turns out that regular stainless steel instruments, even though they're quenched and fired, and I don't know what all terms they're using to make these instruments harder, that's what stainless steel is. It is hardened steel. Anyway, that stainless steel is the same hardness of calculus, so you're always going to damage the blade. You're always going to dull up the blade of that instrument, so you really need to use something different. And when you're using these non-sharpened instruments, you have to do that a little bit different. So what you do is you put the instrument kind of onto the side of the calculus, and you can carve it off from the top down. So you don't have to distend the tissue. The calculus on the pictures is never really the same as what you see in real life. I think we can all agree on that. The XP instruments are almost double, well, maybe not quite double, the cost of traditional instruments. So what they have done to help mitigate that cost is that they've come up with these double-edged Gracies. So you can do the mesial of number 2 and the distal of number 3 without switching instruments, without having a new instrument, without turning the instrument around. So you have this dual ability. So these 3 instruments, I think, replace almost 12. It's pretty nifty how this arrangement works out. So you can get, less costly instruments and still retain this manufacturing style that makes calculus easier to get off and makes these instruments incredibly sharp, and for a really long time sharp. This is what calculus looks like for those of you not in the know. This is what I would consider maybe a moderate amount of calculus. You can see here that the person has been flossing because there's a little line there between the 2 teeth. And so flossing is just so overrated in dentistry. I just can't get over it. So what we've got here is a good example of how you would have to go underneath this to get your bearings here. If you're looking at this picture, is that this is behind the lower front teeth, and there's a big bridge of calculus there. And if you have to use a traditional instrument, you would go in underneath there, which of course will get the tissue to bleed because it's inflamed, and then you will have to really force that calculus off with your hand instrument. And that force is incredibly high. Somewhere, and of course I can't ever find it again, I stumbled across a study that showed that how many pounds of pressure we're putting onto calculus before we have to remove it. And when you add up all of that, it's more work than what a bricklayer or a block layer is doing, a mason, in a day. So that's a lot of pressure, and most of that is in these tiny muscles in your hand. But that does transfer up your arm and into your neck, yada yada. So that's how that whole thing goes. Oh, I do have a little picture here that's super fuzzy about the hardness of the XP instruments compared to everything else. The other thing that we have to start doing is using ultrasonic instruments. The piezo scalers are coming into their own. Most people are saying Cavitron when they really mean magnetostrictive ultrasonic scaler. This is a piezo ultrasonic scaler that I've been working with for the last year or so. It's made by Coltene Whaledent, and it's called the Suvi Elite. What happens with an ultrasonic scaler is that you don't have to go underneath the calculus. You can break up the calculus just by touching it. The handle on this instrument is wider, or it has a larger diameter than any other scaler that I know of. And this is the one of the only ones, I think it may be the only one, that has a light on the handpiece. So wherever you're working, you have full illumination. So you don't have to crane your neck. You don't have to do weird things with the cheek in order to capture some light to the back teeth. So that, ergonomically speaking, this is a superior scaler. But any scaler, any power scaler that you can use is going to be better than a hand scaler. Sorry, American Eagle, but if you're still wanting to use a hand instrument, then you should be using the XP so that you always have a sharp instrument. The ultrasonic scaling has some other benefits. They explode bubbles they create bubbles because there's a lavage that goes along with it, and the implosion of these bubbles disrupts the cell walls of the bacteria, so you're really doing a lot more than just removing the calculus. And there's some discussion about the health of the tissue after using an ultrasonic scaler is improved, or it improves faster than when you're not. The stroke patterns with both the hand instruments and the ultrasonic instruments are similar. You need to get every part of the tooth, every part of the root of the tooth or the crown of the tooth, wherever we find calculus. And I like to say that using a hand scaler is kind of like the bat against a ball that's hurling at the batter. There's just a small section because the tooth is rounded, right? It's not just square. So we have this rounded tooth in 2 dimensions, and we have this flat scalar blade, so we have to really do a lot of instrumentation in order to get that off of there. Polishing, air polishing is my favorite. I prefer air polishing over everything. Most of the places that I work at right now don't have that capability until I get my ducks a little bit better in a row. But traditional polishing with a Profi cup, really think about what it is that you're doing. Is the cup too big? Is the patient's cheek too tight? Do you need a petite cup? Does the cup flare? And is the angle of that Profi angle, that's what it's called, a Profi angle, is that contra-angled so that you have a little bit of a relief on your wrist when you're polishing. Really think through what kind of an angle you're using. And seating is huge. I was over at American Eagle, not American Eagle, I was over at Crown Seating and had a whole day lecture on sitting. And some of the things that he brought up, I've noticed myself when I take pictures of people who are sitting. And what we're taught in dental hygiene school is to sit so that our legs are parallel to the floor. And that is absolutely not how we sit. We don't like to sit that way. We keep scooching forward. And that is how it is preferred to sit. Oh, this got a little out of alignment here, so let me just do this. The seated position in a traditional chair really requires that we slouch. It doesn't support us anyway. Even with the back of the chair, you're just not going to be as upright as you would on a saddle chair. So if you just imagine a saddle and your legs kind of drape over the saddle and there's no ledge, one of the things that happens in dental hygiene is we get circulation cut off on our legs if we sit all the way back on some of these chairs. Even if we're square on the chair, we have a situation where we have this circulation cut off. So by having let's see, reclined, straight, and incline, I guess, kind of a motion where your butt is up higher, your spine is up higher than your knees by just a little bit, and draping over this saddle seat, you are improving your posture quite a bit. I found a picture of a saddle chair for infants as well that are for toddlers that you can put onto like a buggy handle. So if you go to images on YouTube, images on Google, and probably Bing too, look up dental seating, you'll find some pictures too of people and have superimposed spines onto these saddle chairs. So let's go back and talk a little bit more about our increased vision and how to determine whether or not your loupes are working even for you. There are a couple of key features when you're buying loupes. You'll want to have a depth of field that is as large as possible. That means that you'll have a higher focus range. So you'll see not just the tooth you're working on, but the tongue and the couple of teeth around it. So you can sit up straight and see the entire depth of the mouth, for instance, without having to lean in. You want to stay upright and as straight as possible. You want to have, for a dental hygienist, you want to have a wide view. You don't want to have it too narrow. I find that I lose total touch with the patient if I can't see their face. I really held off a long time from getting loupes because of that. I really need to see their face. And you need to have a working distance that allows you to sit up. So what happened with my first loupes is I said, well, let's just try maybe 13 inches. That ought to work. But it didn't. It was too close. So I still had to lean in order to get the teeth that I was working on in focus. So go to the office, put somebody in the chair, work on that person for a few minutes, then have the rep come and measure your working distance. Don't just sit down and pretend to be working. Actually work so that you're in a posture that you normally would be in, and then find a way to sit up from there and get your working distance from there. That is a really good way to do that. Magnification levels, this is, you'll have to really work with your sales representative on that. For me, I would like to see as much as possible and just have things be a little bit bigger. For a dentist who's doing an endodontic procedure or a precision dentistry, you'll want to only see the tooth. Plus you have an assistant who is keeping track of what the patient looks like. So if the patient is uncomfortable or starting to cry, which has happened to me, you can really make a difference there and see better, have an ergonomic benefit, and still have patient comfort, because you really can't practice dentistry without having a comfortable patient. So then I went to Orascoptic a few years ago and I said, you know, there are no studies to show that going backwards when you're already in pain and purchasing proper seating, proper lighting, and proper loupes, and whether or not that helps alleviate the pain. So they helped me do this study. We sent out, I think, 10,000 invitations. We had a couple of hundred, I don't know, 1,000 or 800 or something people respond. And we found that everybody that who started in pain and purchased proper lighting, ergonomic chair, and or loupes, all received an ergonomic benefit and had a reduction in pain. So that was really nice to know. Really nice to know. I have a saddle chair, an assistant saddle chair up right now. And for those of you who are watching this as opposed to just listening to the podcast, there's an arm that goes across the front of the assistant, so the assistant can lean forward and have support with this arm. And by using a saddle chair, they are not sitting crooked and having a foot on the ground. Crown seating, they told me, is the only one that has put that center post off center, so that the person sitting in the chair doesn't feel as though they're going to tip over. So between that moved pole and the saddle style seat and that ring on top to help stabilize the forward leaning, you have a very ergonomic chair. So, and then we have to talk a little bit about anti-inflammatory foods and making sure that the diet is right. You'd think that I just love talking about this stuff, but I really don't, and I really mostly talk about it so that eventually somewhere, some cobweb in my own head will get kicked off, and I can lead a healthier life myself. So anti-inflammatory foods are those that are high in flavonoids. Things like green tea are anti-inflammatory. Turmeric is getting to be extremely important in the anti-inflammatory world, and you can get turmeric in capsule form, so you don't have to cook with it if it's not something that you really enjoy. You can just take it. It doesn't have a taste. There's been a thread on one of my dental groups talking about diabetes and cinnamon. And cinnamon has been shown to help stabilize blood sugar, but when I was taking the cinnamon capsules, I was burping cinnamon a lot. So I don't know if there's a way around that, but it's not very pleasant when you belch and then up comes a pile of like cinnamon powder. I don't know, it's weird. Berries, the deep dark colored berries are very high in the flavonoids. Cranberry is big. It has a lot of really cool benefits. Beets, anything that has a really dark color. So I hope that this is helpful to you. Find yourself a chiropractor, somebody that's not just going to charge you money to crack your back and call you good enough and say keep coming back forever and ever. You will, if you are a clinical dental hygienist, even though you're practicing at the highest level of ergonomics possible, you will still need to see a chiropractor at some point. And so don't think that these chiropractors are just out to get your money. Maybe some are, but maybe they're not. And then the other thing is to find yourself what's called a neuromuscular therapist. This is a highly trained, very particular kind of a massage therapist. They have had extremely high level of training in ergonomics and muscular, how do I want to say this? Muscular mechanics, body mechanics. That's what I'm trying to say. Boy, oh boy, that was a long way. So the body mechanics is what you're really going to get out of these neuromuscular therapists. They're not always listed as such, but you can look at St. John's technique. If they are have been trained in the St. John's technique, then you know that they are at a different level. This is Shirley Gutkowski. This is Crosslink Radio, and I hope that this was beneficial for you. Please pass it on to your friends. Join me at America's Dental Hygienist on Facebook, and we'll see you soon.